Okay. Forum, I've been told.
So do.
Good. The first item is the minutes from the August 12th meeting, which were sent out. I hope you read them. As usual, they're quite complete. Thank you, Jane. Any
Things I didn't remember.
Yep.
I look at the thing. I go through with the recording,
Oh,
but
my
You
God.
can always rewatch the video if you forget.
Yeah. That's an exciting option. Any corrections, comments other than praise? Good. I need a motion to approve.
so moved.
Second. All right, moved and seconded. Any discussion? All those in favor? Aye. Good, thank you. Out of great respect and a need to know, we've moved the public health nursing update to earlier in the
Yes.
agenda
Yes,
because
yes.
last time it got totally wiped out.
That's okay. Understandable.
So,
COVID's still here, shocker. No monkeypox cases yet. Hopefully that will stay that way. I was looking at, I read the notes. So Maureen was looking to see about, it's possibly we could set up the at-home testing that people could possibly do if we set up an app or so. I don't know how that would be done. As of right now, Amy has it on hold because we're just busy getting ready for flu clinics. Car seat program is slowly picking up steam. I went yesterday to the Bentley Ave Apartments, which is a new place over by the wastewater facility. And the girl that I met with, I gave her a bunch of flyers because she says I've counted at least 40 kids in this complex.
wow.
So I'm hoping, I'm like, please tell everybody and anybody that you know. I'm like, I have a ton of car seats to get rid of. I got the second shipment, the ones from Toyota's Buckle Up for Life. So yeah, we have those.
Do you have any flyers with you?
I do in my car.
Okay.
Yep,
We can watch.
English and Spanish.
English and
Oh,
Spanish,
great.
yes,
Because I know that behind the Curtis, there's an apartment building of affordable housing.
yes.
And the kids that go to the after school program at the community center west of you.
Yeah, that would be great.
Okay.
I got a call from Hevra. I guess
They have a preschool.
they do have a preschool program, and I guess the family showed up with the kids sitting on their lap. So she was completely freaked out by that. So I'm actually gonna go there next Thursday morning between 8 and 9 during their drop off time. She's gonna introduce me to the parents, and yeah, and maybe see if just get a quick look and then set up times with parents through that. So yeah, that was exciting that she reached out to me. So
That seems like a great model, Jill,
yeah,
like, having like kind of a meet and greet and
Yep.
then scheduling from there. That seems like a really
Yeah.
great model.
and they're having their open house tonight. So she's gonna give out the flyers ahead of time. And then she says that there's like caregivers that come in the afternoon. Want to make sure that either their car seats are installed correctly, or if they don't have one, I want to make sure everybody has one. So yeah.
Yeah, and then we have a lot of car seats.
Yeah.
It's taking up a lot of space, and we've already been kind of slowly discussing like what would a clinic look like. It's a lot because like Jill, and I won't speak on your behalf, but like you got to take the car seat out, you got to destroy it, you got to do education, you got to do all this stuff, then you got to install it. Imagine Jill having 20 cars lined up doing it herself. It's just a lot, and I think we are ramping up for our flu program, and it's our first time out of the gate, and it's taking up a lot of time right now. But I think one of my other thoughts, when you find time is, and you may have already done this, is maybe get a list of like the preschool programs, like Busy Bee and Lee,
Yeah.
Lennox
I gave
Community
them all
Center.
flyers, but
Oh,
they
good.
need to
Yeah,
set
great.
up- I think they just set up time to
Yeah.
actually host a clinic at those
Yeah,
places.
it's just, but yeah, they take up a lot of space.
Yes.
A lot.
Yeah.
I have space in my garage.
Yeah.
I got a ton of space too.
Well, the first shipment came, and like, we're in a really old building in Lee, but they're actually talking about building a public safety building, and they're trying to make that a reality in the next couple of years. where we would have a nurse's exam room, we would have a loading dock. We're talking like a massive public safety building, hopefully in Lee. So we'll have our own nurses' offices and whatnot, but like we stole the DPW director's office and they're like stacked to the ceiling. And the guy pulled in one day, he's like, hey, I have an order for you. I'm like, oh yeah, just put it over here. He's like, no, I have a whole truckload. So anyway,
Great.
I do have a garage and a porch on a house that I rent in the center of Lennox behind St. Anne's. If you,
Yeah. Oh, I have
Wanna
plenty of room in my
stack
garage
them.
in my basement. If push came to shove, we had.
You should have had her address. Right.
Jane, do we want to add the vaccine conversation as part of the nurse update?
Yeah, I think that.
'Cause I don't think
Yeah,
it's,
that's good.
okay,
So go for it. Who's doing that?
who wants to start that?
So we've got part of our shipment that we purchased from Sanofi or Sanofi, that's how they said it. And our fridge is completely full. We got our delivered yesterday was the new COVID booster and state flu vaccine. So, we got our second refrigerator set up yesterday. Today we'll be able to upload the data logger to the state. They'll give us a gold star for, it's all good. I did have to take the COVID vaccine up to Pittsfield Board of Health. There are backup vaccine storage. So as soon as we get the green light that we're good with a new refrigerator, I'll bring that back down. And then we're gonna go through, Jane and I are gonna go through that fridge, figure out, organize. I think we'll pull the high dose out because there's less doses of that than the regular and move it into the little refrigerator.
And take out all the sandwiches and things.
Yeah,
Yeah,
exactly.
the
Take off
sandwiches, yeah.
sandwiches. Yeah,
Yeah.
exactly. And I'm gonna call Sanofi and ask them to see if they can delay our second shipment a couple weeks later into October.
That'd be a great
It's
idea.
supposed to ship at the end of this month. I'm gonna just beg and plead with them to
Mhm.
postpone it a couple weeks till we get rolling on our clinics.
And the good news is we're ready, right? Like,
Yes.
we have all of, we're just kind of waiting and, so you'll start seeing these and, feel free, I did. Most of the 14 community clinics are approved. We're waiting for just final proving for one, but we are excited about that. We have individual town flyers. We have been working with CHP so that hopefully there'll be coverage like 1 month, and then if we're doing it 1 month, that they'll schedule far away from ours, so that the community gets the benefit of having multiple vaccine providers come in. And in fact, I know this is a lot of, like here, Sandusfield, like this flyer actually has CHP information and then ours. So it's not about who's giving it. We just want to put out information about like, okay, Sandusfield, here's your opportunity this month. There's one coming up next month. That's it, kind of been our approach. So I think that that's good. And CHP, I think, is appreciative of the conversation back and forth. I have talked to working with Heather Barberry. Actually, this is a generic flyer here, and Fairview is in the process of getting this translated for us. So we'll have it in Spanish as well.
Vim from here and I could. but
Mhm.
we don't have it in Spanish.
Nope, not yet. Yesterday we sent it out, and so I don't know how long it takes to do that, but so I would say by next week, we should be getting it out in Spanish and English. And then at that point, we'll start distributing these in public spaces. And also, ask the towns, do you have a colored printer, or would you like for us to print some out and drop them off in your town? The one thing that would be great is if in the individual towns, if you guys could be responsible for figuring out where to put them so that people will see them.
Oh, sure.
We do have the list of all of
We
the,
only need 2. There's only 2 places to put them.
okay, I'll do one for you. I think that just getting the word out, people are looking for this bivalent booster.
I think we're gonna be busy.
And so we're gonna be busy, and we'll adjust our schedule as needed. So Heather's still trying to figure out whether she wants to do a friends and family. And she has done that in the past. She's done a great job, and that's the one that I've always gone to.
Yeah, me too.
And she's not sure if she's gonna do that or not.
Right.
So if that doesn't happen, then there'll need to be discussion about making sure that we fill
The void.
consider the void.
Because they've always swept in all of them staff in that
Oh, okay.
process.
Mhm.
So, and that's like 15 people by the time you're done.
Yeah,
Uh,
well, and if they don't do the friends and family, the other thing that's gonna be missing is the egg-free. Because they provided, I think, most of all of the egg-free vaccines. So I just talked to Heather this week, and so we'll be coordinating with them as well. So just trying to make it a coordinated effort.
But would they be willing to provide us the egg free if we built like a Saturday clinic?
That's certainly a question for them.
Yeah.
Yeah, we could ask them that.
All right.
So we have our set schedule. I haven't figured out a good format to like list them all yet. These are the community clinics. There's 14 community clinics, and then we're doing them in all the schools. And we're not putting out that link out to the public, the school ones.
Yeah.
And we're currently staffing those, so, yeah. And Hussey Dome is not confirmed, but other than that, all the other ones.
Great. I can't imagine what it's gonna take to get this done.
Mm.
And you need civilian volunteers to help?
Yeah.
Yes, so actually what Rebecca has and is a Google form, and so we're gonna need like people to check in, scribes. We're gonna need people to help other people, walk-ins register. And so there's, I think, 5 slots that we're trying to fill for each clinic. So we do have the links. It goes right onto a document, or you can work with me and I can fill it in for you. So we are actively looking for volunteers.
Do you have to be part of that state?
MRC.
MRC?
No.
No.
No, I think for like the schools, we're gonna, for the community ones, absolutely not. And I think that having people that are attached to the town is great as well. Like, for instance, Heather's mother, Linda, has always done the vaccination clinics, right? And so I have a list, and so I want to make sure to reach out to Linda and see if she wants to do the one at the senior center for that familiarity. So
Sheffield is non.
so we're still working on getting for Mount Washington, Sheffield. What was the other? There's in Tieringham are the 3 towns that haven't had them yet. And Pat, it would be great to sit down with you and talk about what you think would be the best approach on like the place and whatnot.
Well, the senior center certainly is a good start, and if not that, or both of that in the library.
And I was, because I know Big Y also comes into,
To the senior center.
but I think we can still provide clinics in Sheffield, just like in Sandusfield, having like CHP come in.
Mhm.
Yeah.
Yeah, because, right, I mean, that's geared toward the seniors. It's not a general public thing, although the public signed up, but they don't really play to that audience. So if we wanted a general one,
We would love to get that scheduled.
so why don't we look at the library then? It won't be a conflict.
Okay, great.
Because for Mount Washington, it just makes sense for us to tell our people to go either to Egremont, Sheffield, Great Barrington, and just say, you know, if I had a huge hue and cry, for people saying, well, I don't want to go anywhere. I'm like, where are you gonna hold it? You know, you could have a town hall,
Yeah.
but it's just, everybody's off the mountain, so it's just,
Mhm.
it's silly
Yeah.
Right.
to take your resources and dedicate them. So if you don't mind having tags.
No, and so, and I just wanted to show you guys so here's our website, okay?
Yes.
And it says list of
For going
upcoming
shopping.
booster clinics. And if you click on that, they're all listed as approved so far.
Mhm.
And so we can distribute that link as well as.
Yeah,
Heather.
if you just give us that link,
Okay.
then
And
I'll
then-
put it on the website.
And each one of these is hyperlinked to the color program. So each link is the same, but people are like, oh, I want to go to that one. Click. no, it's just taking you to the same place as everybody else, but, so that is also up and running. If you'd like assistance getting that up on your website, I'm happy to create like for like the, like for Sheffield, for instance, you know, come up with an email, send it to Pat and be like, Pat, is it okay if we put this on the email? And then Pat could pass it along to the powers that be.
Yeah, right, right. I mean, frankly, the senior center is a better place, because you can just walk straight in.
Mhm.
The library, you have to go down, the elevator. So
Okay.
that ends up getting a little more cumbersome.
Let's talk about it, so that we can get that set up.
Are there school clinics on that list?
No,
No.
they're not on that
doing-
list, but so we're gonna be outreaching directly to the school communities. With that link, so, if you were to go through here, it actually is listed, but it shows there's no appointments. Because we only have one account. And so I'm not sure, and I am open to suggestions on how to present that to the public.
Like the
Yeah.
schools.
And now parents, if someone comes in with their kid, of course, and we just don't want to put it, or
Like random people showing up to the school,
Yeah,
that's not
right.
part of the
I-
parents.
if
and-
it's
Let
during
the
the day,
schools
that's why.
Yeah,
Get
yeah,
in the middle of
they
that.
can't get into the school.
And the schools, the staff are having a separate time during the day, like during lunch, like a 1 or 2 hour window.
Right.
So if they can't go during the staff time, then they're, welcome to sign up for, the after school.
Right, and they have a lot of people for outreach into the families that are gonna need extra assistance and stuff. And otherwise, they were just taking on too much.
What's the school saying? Have they said anything for what their preferences and how to deal with the school-based clinics?
What do you mean?
Like, okay, you send a link to the superintendent, say, okay, we're gonna do Lee Memorial Middle and High School. You share the link with your school employees and have them register.
Yeah,
Because you don't want to just put it out to the regular
No.
public, because you have Joe Schmo that's not
Yeah.
Cory check trying to walk into the school, do a clinic.
yeah,
And
exactly.
that's the whole point of not making it public.
Yeah.
But for me, like, as long as the school knows and they're on the same page with us on how to get access to that clinic,
Mhm.
it's whatever makes them comfortable
Yeah,
and
Right,
happy.
exactly. No, I think they're separate. It's when they click on that link, it's just for the schools. It's so not anybody can get in to register. Yes.
Yeah,
no, maybe.
I'm not sure what that will look like
Clinics
yet.
has a thing that goes out to just the parents. of
Yes.
The schools,
Yeah.
and Mark sends stuff back and forth that way. So if I'm hearing you right,
Yeah,
Lennox, only parents of children
Mm-hmm.
in the schools get his newsletter. I can't get it. I don't have anybody in the school.
Yeah, but it can be easily passed on to
Right, but they
others.
can pass
Yeah.
on that extra access. That's the thing, is that the schools need to be responsible for saying. Staff and children and parent and families of children registered
right.
are the only ones who can come to this.
Yeah.
And let them deal with,
The interlopers.
right,
Right.
and because.
I think it will be,
Well, they're not gonna turn people
I guess one of my, and I don't know enough about color, so. But when you send that link, the school link out,
Mhm.
and they distribute that,
Hmm.
how do you know if there's enough? You said there's no appointments.
No, there's appointments.
There are appointments when they
Yes.
send it out. Oh, I see.
With that link, they would get the
Oh,
appointments for
but
the
the
schools,
public looks
but the
at it.
public, yeah.
Yeah.
That was my question.
Yep. And then, the one thing about the schedule, you'll see a lot of middle of the day, we really are focused, like by the time of day, we're really trying to focus on the most vulnerable. But again, if there's a need for evening clinics or a weekend one, then we'll meet that need.
Well, that's where I think Vim may come in, because they've done collaborations with Fairview,
Mhm.
in terms of their clinics, and then have staffed them with Spanish speaking staff. So I would assume that might be a way to proceed with that population, which is large.
Yeah. And it would be it would almost need to have the crossover. I was involved with Heather doing the clinics up at Du Bois,
Right.
and those translators were a really important part of that
Right,
piece.
no, and they're happy to help with that.
Mhm.
We just need to organize it. So who did you did that strictly through Fairview? Or,
At that time, it was through Fairview, but we'll,
Do you know Natalia DeRusso?
No, I've had emails with her before, but I have never met her directly.
Okay.
Okay,
She would be, I have a meeting over there after this. I'll figure out who is the right person
Perfect.
to work with you on that.
great.
Yeah, we should definitely have someone at these clinics that can do that, either through working with Pat and her networks or MRC or somebody, be prepared for that.
Mhm.
So we're not scrambling, trying to sort that one out. And I guess my only other thought was like, once you solidify the calendar, I would just make it official, throw a SBPHC letterhead on, and we can get it out to the Eagle and the Edge and so on and so forth as well to distribute that.
Perfect.
Okay, thank you.
And the only other thing that I would say about, doing email for us for the websites is that I think website notices need to make sure that people understand that there are multiple ways of them getting information. There are multiple ways of them, there's, as you were just saying, there's, if you have a child in school, contact your school. If, one of the things that always, didn't work for me when I was working was the fact that everything was always during the day. And so the evenings are important. I mean, we have to be able to,
For the working people.
yeah, you have to be able to
Yeah.
serve this, so.
Good, okay, thank you. A lot on your plate. I'm glad we moved it up.
We have enough vaccines, and if we need to order more, we can. Right.
Yeah, I did talk to Sanofi and they said, if, we found out we needed to order more, we could. Okay, yeah.
And we're also picking up a lot of people from outside of the state, just so that you know, in our border towns.
Mhm.
Second homeowners are not dealing with New York.
No.
And
More the
New York was-
merrier.
Yeah, and New York was very efficient. I mean, I was like, so go home. I mean,
They're not going on.
but they're not going home. They want to get it done up here, and they are.
Okay,
That's okay.
the next topic is opioid settlement, and I'm not sure if.
Gary's on,
Gary is
enjoy
still there. I'm not sure what there is to report. I mean, we have a document, but we haven't finalized.
Yeah, so I think where we left it, and I know Gary and I went back and forth a few days ago, and kind of where we're at. So we had an original draft, and I think we met. We discussed at the last meeting the need of putting something about sustainability in there.
Right,
We did talk about a specific ask, but there's challenges with Gary with receiving federal funding that he can't really specifically put an ask in. And then I think we were discussing about whether the budget that he initially put in had relevance to like from our ask perspective. So I think we need to reconvene another meeting and kind of, I mean, I can help frame out sustainability, because it's like, okay, and the argument being is we have 15 years of funding, which is a sustainable piece to gather to keep rural recovery sustainable. That's an easy argument. It's just, we got to figure out what the specific ask is. And if rural recovery can't be the group that does the formal ask, we need to figure out how we're going to deal with that on our end. Does Pat through the Board of Health take the lead on Sheffield's ask? Does Rebecca take the lead on Great Barrington's ask? Do I take that lead on Lee? I think we need to navigate what that is. And I think there's still time to sort all that out, but I think it's just been a really crazy month. And what I'll do is before the weekend, I'll shoot out an email and maybe see if we can get a couple
right,
dates together to reconvene and kind of see where we're at.
yeah, I think we're close.
Gary, anything to add? You can't hear you, Gary. I don't know what's going on.
All right, can you all hear me now?
Yeah,
Okay, great. I'm on my phone. I'm getting my car serviced. So through some budget finagling, we have figured out a way to give me 1.3 hours per week where I can actually make asks, like it's not through federal funding. So, yeah, so I can make actual asks now. So that's an update. And I just so happen to be working on a sustainability plan for HRSA anyway. So, entering some sustainability language into the 2-pager shouldn't be a difficult thing. So, working with the subcommittee, like I'm still, looking forward to doing that. And, yeah, hopefully we can move forward with that. I'm not exactly sure what an ask would look like, if I go to all 14 towns and, ask them, ask the select boards or whatever, but, whatever it takes, I'm willing to do.
Yeah, so I'll shoot out some dates for the
Right.
4 or 5 of us to
Right.
reconvene in the next couple of weeks, and we can
Great.
see where we're at.
Good. Gary, I just want to take advantage of having you face to face. That Tuesday is the Narcan training for the Board of
Yeah.
Health, and I've got 13 people now.
Okay, great.
Yeah, okay, and
Awesome.
it may grow slightly.
And Mount Washington would like to schedule one.
Okay.
Okay, terrific, thank you. Topics for discussion, the draft articles of organization, which we haven't seen, so we probably need to review.
Well, it's the same as what was last time. But if we don't have the bandwidth for dealing with it today, then that's fine. We talked a little bit about goals last time.
Right, I would like to really
Okay.
Yeah,
sort of study it.
yeah, but in this, we're in no hurry for this.
Right.
Like, it's not a
It's an
requirement
internal
of
document,
PHE.
yeah.
It's for our use.
Right,
It's a summary of the IMA. It's for our use, so we can tackle that whenever. I think we'll keep it in the parking lot, Jane, on the agenda, so we don't have to. So when we find time, it's actually on the agenda. We can talk about it.
Great.
yeah,
Yeah,
thank you.
but provide us some, up thoughts and ideas on it as we
Right,
move along.
yeah, that would be.
Oh,
great.
someone's coming
Yeah,
in.
please look at it, study it frankly, because it's stuff that we're gonna try and live by, and we want to be sure it's inclusive, but not too confining, I guess.
Would it be helpful if in a couple weeks I send an email being like, hey, guys, maybe could everyone just take a quick look at that and just give me some feedback
Sure.
so that I
Remember,
can
we
have a
agreed.
draft?
Yeah.
Sure.
Okay.
Perfect, Jane, thank
I
you.
think a couple weeks is great, but I know we're all staring down a barrel on this capacity assessment that's gonna take some of our time
Yeah.
up too as well.
That's true, maybe after even. At some point, I will send an email.
Good. Let the minutes show that Jane has agreed. Okay. Public health excellence grants, 2 of them, yeah, or 2 aspects.
Yep. So the capacity assessment's gonna be coming down, I mean, any day now. I don't know about you, Jim, but like every day I open my email, I'm like looking expectantly at the screen.
And Mike Hugo actually just jumped on the call too, so
I
I-
did. I'm gonna shut my camera off, but can you hear me?
I
Yeah,
can.
Okay, I'm gonna shut off my camera because I'm driving and I don't want to get distracted. I don't want you to see what a lousy driver I am either.
Oh,
so-
God, yeah.
Nice to hear a lot of
Nice
praise.
So I know Jane sent out an email to some of the towns, we're kind of divided and conquering to assist towns. It's supposed to go to each town, and so like each town's got to take some kind of. We don't want to be doing capacity assessments on behalf of the collaborative. Collaborative should be able to do it, but I think we're here, especially the smaller towns that don't really understand the larger scope of public health. Most of us here are seasoned already, but some of the small towns may not understand camp inspection. So we've offered to sit down with them and say, we can help you kind of answer the questions. And the goal is just to be honest. And I know like you and I've been talking to a lot of different people. People are anxious, they're scared, they don't want to do it. I frankly, I'm ready to roll. I'm like,
Let me
if I can do it better, I mean, in my mind, I feel like I do a really good job with my tri-town add-on.
Mhm.
But if we're not doing something, I'm not afraid to say we can't do it. We don't do lead determinations. We don't do certain things because we don't have the staffing capacity. I'm not afraid to tell people that we're not doing something specific because give me more resources, we'll do it.
Right, right.
That's my philosophy. A lot of people are worried about it. I'm like, bring it on.
Mine was that there are so many things that I'm not doing. That I'm like, could you just give me a list of what the hell I'm not doing? Because, then I could just look at it and go, no, not doing that one today either. And it'll make me feel better.
But I will say, there's a couple different, Jane will get into it, but there's a couple different phases. They're saying the first phase is relatively quick. But then phase 2 or 3 is going to take some time. And I think what we want to think about for the health agents in the room is like thinking about, and I don't know what it looks like, so don't do something that you may waste your time on, but they may ask for copies of previous inspections.
Right,
They,
well, I think this is the thing that's actually scaring people. All right, we are already so stretched. The idea of having to sit down and collate a bunch of stuff, I mean, if you want my input, great.
we're gonna help. We're
No,
gonna
no,
help.
I know, but this is what the state kind of thing is, again, not what they're thinking of. They're not
Although,
thinking of
well,
what's hitting the ground.
I think they are, but there's gonna be some heavy lifting with some hopefully reaping of benefits that come with that. You know, like one of the things I'm thinking of, you know, like I had all my guys like pull all their licenses, make copies of their serve safe and CPO and so that where it's kind of put them to the side. Like for those that are on online permitting, it's super easy. Like I can pull inspection reports with a blink of an eye. I can pull
Show off.
reports with, no, I mean, that's well, when you guys get to online permitting, it makes life a lot easier. You know, it's like, there's gonna be a little bit of a heavy lift in Sandusfield. There's not much going on in Terryham, but some of the really small towns that don't have any capacity or there's not much going on, that'd be relatively easy.
Check all of that.
But it's, I think Jane and I are here to help
Yeah.
sift through that, and
Yeah.
it's gonna take a little bit of time, but I think it's worth it, in my opinion.
Oh, I think it's worth it. I just think that I'm just looking at the workload of what everybody has, and to go and just start pulling stuff together.
Well,
It sounds easy when you have staff. When you don't have staff, it isn't easy.
and I don't think, of course, and that's why we're here to.
Yeah, and do we want to, Mike, do you know what the assessment's gonna, or do you know what it's gonna look like?
I sort of do. There's a couple of things that I probably want to just jump in here for a second. First of all, as far as answering it honestly, and there's the embarrassment and the stigma factor, if you want to put it that way. You want to make yourself look pretty bad on purpose, although you don't want to lie or stretch it, because the worse you look on paper, the more you're going to get. The $300,000 grant that you all have is really the entree to the real money. And if you identify a gap in what your services are, the state is going to fill that gap in with money and with resources, and in some cases with additional employees that will be actually coming from a different source than this public health excellence grant. So you want to really, the worse you look, the better you're going to do on this. That's sort of counterintuitive. Nobody's grading you. Nobody's watching over what your individual town is. And to that end, one of the things that Cheryl and I have worked very hard on through this program is making it as easy to do as possible for people on your level, on the health director level. The questionnaire will take you less than an hour. It's been tested on a bunch of different people who are health directors and some former health directors to see exactly how burdensome it is. It should not take you an hour, is what the bottom line is with the questionnaire. That's the first thing. You've already supplied a lot of information as a result of the email. And if you haven't, go back and dig out that email and pull the stuff together. But my guess is that you've already all done probably everything that's in that email, identifying your staff and all of that. Each of the staff members, I'm sorry.
Mike, I think that we're all kind of looking, so, we sent, we're not really knowing what email you're talking about.
Okay, so actually, Jane, take notes because I'm driving and I can't, but
Yep.
shoot me an email afterwards. And it's the email with all of the
Oh, the contact.
staffing,
Oh,
the
yeah.
contacts. Yeah.
Oh, yeah,
Okay.
that we did.
All right. So the reason that you're getting the contacts is that I think it's phase 2. I don't have my slides in front of me, but I think it's phase 2 where the DPH is actually going to reach out to all of your contacts.
Oh, yeah.
And they're going to ask, and that also includes, we've actually, MAHB is insisted that even the Board of Health members get contacted. We want to know who has taken our certificate classes, who hasn't, what the level of sophistication, are you a dairy farmer or are you a physician? You're a Board of Health member, you're a volunteer, we understand that. What can we give you to better train you? And we're prepared to do a bunch of smaller certificate type programs where we'll come to you and do things. We're preparing a bunch of Zooms right now to address the shortage issues with the Board of Health members. So it goes to that level. For your own protection, this is way off the record. For your own protection, we are advising that you don't print anything out. We have worked it out with Sam and with DPH. That what you're going to be getting is it's like a Google Doc. It's actually, and if you answer that and don't print it out, there's no record of your answer anywhere that's discoverable. And we are advising people that you don't want a paper trail. And we've even worked it out with DPH and in the design with Don Sibber and MHOA. Don has the
Broken up, Mike.
Mike.
He's traveled some.
Stop.
It's a bummer because it seems like good stuff.
He's a mom.
Yeah,
Oh, Mike.
which if he has AT&T, actually works.
Breaking up a little bit.
A
We'll
little.
give it a couple seconds.
Is he even there yet?
The banjo's playing, yes.
Oh, Mike.
Can you hear me? Not?
Now we can.
So we
Okay.
a few minutes.
We lost the after paper trail.
We just lost.
Yeah, we lost the paper
Okay.
trail.
Oh, we're losing it again.
Okay, all right, so, okay, so you don't want somebody doing a FOIA request and embarrassing you. And
Gotcha.
so
Yeah.
we designed it so that the Survey Monkey goes to a private contractor, not the state. It goes to be. Can you hear me now?
A little bit. So what I'm hearing then is if you fill out the Google Doc, and you say, you know, I've only done one round of inspections this year, and you send it in and you don't print it out, there's no discoverable record. Is that what I'm hearing?
Yes. He can't hear you.
Or you
Yeah.
can't?
Yes,
Okay,
Yes.
great.
actually, give me, if you give me 5 minutes, I'm gonna get to my computer and
All
I'll
right, yeah,
I'll call back in.
we'll
Because
jump
what-
into
what-
Another topic.
the top.
Yeah,
Another.
because this is wicked.
Yeah, all right, yeah, we have this, we got to talk about the supplanting of slides there, then we'll come back to you. Well, that makes sense because like, well, you don't want the select board to come over and say, well, geez, you know, you got a budget of this and you're not doing this, and I can understand.
Exactly.
Yeah, okay.
Exactly.
Do we want to just,
I'm-
we'll wait until you get on a computer, Mike.
Mike, keep driving, and we'll come back to you in a couple minutes. It's breaking up really bad.
Do we want to go to
I'll be
FD?
back.
Sure, yeah, whatever.
Go ahead.
Okay, so FDA, the grant that would be the $20,000 grant that I had been hoping to do kind of as a group is very, very
Laborious.
no, it's very competitive,
Oh.
and only a certain percentage of those particular ones are going to get
Funded.
funded. So here's what I'm thinking, and I'm just spitballing it with you guys. Sheffield and New Marlboro, I think, are both interested in having follow-up to what we built this year. And because these resources are coming down from the state, you know, what about just doing like a bare bones one, just so that if we have any equipment that we need, or like training, that we would have some resources for that, even though I think we're gonna have it anyway.
Right, but you can't count on that. I mean, I think we have to make wise decisions at each point. And I'm not saying
Yeah.
that what you're suggesting is not a good thing, but I don't want to assume that it's coming, at least not in the next 6 months or whatever. So I would say, yes, let's figure out what the best FDA application is. And if it's a general one that would benefit the group or specific with a couple of towns,
Mhm.
whatever you think gets the funding.
A general one would definitely be able to send us all to the trainings, which I think are exciting that we can all go to trainings. You might not always want to go to the food track, but this is a way to do that. And I think that maybe, so I will have something solid come put together. It's just, there's so many. It's the deadline's not for over a month, but
That was my next question.
my brain is just very full with all of the possibilities, and I don't want to write something on someone's behalf, right? Like, so like Great Barrington, for instance, you guys are gonna get a new inspector. Do you have anyone hired yet?
No, we don't.
Oh, bummer. I was gonna, I was hoping that. But we just want to be here and make sure that we have the resources for you guys. It's part of the mission of this organization, and so. But on the other hand, I don't want to chase our tails as far as like saying, we're going to be doing this, this, and this, when really we just want to be able to support and build our food programs.
What are the possibilities again? I know we had learned that we could go as a collaborative for the $100,000 grant, which is like the big ticket grant. So we could do that. We could go for that grant as well as these smaller grants, or are you talking about one or the other?
So the large grant is only offered every 3 years.
Oh.
So we passed on it last year, and in a way it's good, right? Because otherwise all I would be doing is food. So in a couple of years, we will be able to apply for that. And what I'd really like to see is like build up our capacity. Example, Ellie's almost standardized. So if we could have like build up our, the Tri-Town guys are going to get standardized. So if we could get ourselves to a point where we have, I was saying an army, but like a core group of people.
Soldiers.
A small platoon.
Well,
Yeah.
and also too, maybe we end up getting another full-time floater inspector, so we'd be prepared for year 3 and going crazy. One of the things, and I don't want to speak for Jay, but like it's becoming like a capacity problem too, right? It's taking time to write the grants. She's got to do all the reporting. She's got to do this. She's got to do that. And right now, technically speaking, she only gets 6 hours for the collaborative. That's it. Like, and it's
Get more work done.
and so like, and I don't want to go into a different direction, but so it's like, I think, we don't want to dismiss the resources. We want to just be, we want to be capacity minded doing that. It's just one of those things where it's like, we kind of tackled all these different applications initially because, the Alliance was doing their thing. We were just kind of up and running. It was fine. But I think as we start to build capacity, we have staff that can do the inspections. It's a lot of work. It's a lot of work.
Well put. What are the possibilities for this year?
So for this year, so you can put in a base grant, which is $5,000, and there's plenty of things that we can do for that $5,000, and much of it.
That's on behalf of the collaborative or each town?
An
Yes.
application, whether it's the collaborative of our town. So if we did it as a collaborative, we would still only have $5,000.
Oh, I see. Yeah.
And if we did it, and then you could do an add-on grant of $5,000 for the risk-based assessments, which and some additional work. So it's up to $10,000 for one application, whether it is the collaborative or individual town. Now, I feel really good about the work we've done with the individual towns. And so, I think a group application, because it is really capped at $10,000 plus the training funds, that would really limit what we would be able to do. But it could also be a resource for towns, for small projects. And we are working with the Alliance as well, so they have some things that they've got going on and that we have committed to plugging in with it as well.
When you talk about the small towns and projects they might want to do, it also sounds, however, like you don't have the wherewithal to do them. So are we really talking the more medium or larger town to do projects other than having you do them in the small town?
Yeah, well, and that's the other thing is the plan can't be from. We got to build up our capacity to have other people be able to do the work. Like for instance, in trying to get Jordan hooked up with Nancy Ruderman so that they can do a round. So we've done one round of inspections. We're doing what's called we have to do 25 joint field inspections. I mean, that takes a lot of time to do 25 joint field inspections. And so Nancy's great that she's willing to come in and do the other half of them. And that will be good because it will free my time up, but also Jordan will get more experience with a different inspector, which really has a lot of value. So it's just, I think that that this whole capacity assessment, it's really exciting. It's hard because we don't really know where to stand, right? Like, we don't actually know what it is that we think we know what we're gonna need, but we don't really know what we're gonna get. And so it's just a transformational period.
Yes.
Yeah.
So, and then this $20,000 that you're speaking of, is that for individual towns or is that another possibility?
It could be it's under an
Or-
application, whether it's,
Okay,
yeah, and that has to
so
be,
those are the two grant applications.
so
I
if
just
we were
wanted to
to.
get an idea of
Yeah.
what the options were to apply for within the next month.
Mhm. And I could sit down with Great Barrington, for instance, and be like, Great Barrington, what do you want to do? And Great Barrington could apply for their own. And I just can't keep doing heavy lift. I can't be the only person doing it, but I'm happy to help. And honestly, I think Great Barrington could really utilize those funds. I did buy, for instance, and I'm really excited about it, and I have one for you today, Rebecca. It's like, I bought a thermal plate, so,
Oh, yeah, something that we were,
so there you go.
do I have to give this to Rebecca?
No, this is
So,
for
so,
me.
so basically, what, I think how I, like, for example, like, Tri-Town is finally all in on the FDA stuff, right? Yeah. So basically, to summarize, each individual town can tackle their own grant, but we don't have the capacity to manage all these
To do all
individual
of them,
grants.
right.
Or we
So-
could, or it's either that, so there's that decision, or we can do a collective one and then just put the resources wherever the town sees fit. Because I will tell you, like, we're doing I don't mean this in a bad way, like, we're finally doing FDA stuff, but Jane's doing a lot of that heavy lifting for me because I have zero capacity to do it. And it's, but we can't sustain that long, but we're getting the guys trained and whatnot. And so I'm in no position to go after my own FDA grant next round, because I would rather just like give it to the towns that need the resources and we'll tap into whatever. So I think how I'm reading your mind is like one application, but there's limitations on funding, but we could put it to good use, or each town can kind of tackle their own thing. But I will say,
honestly.
okay,
Say Great Barrington wants to go for their own.
Yeah.
That doesn't mean that the rest of
oh,
us.
right.
Couldn't do, and I'm sounding like maybe we don't need to be all in one deal here.
Yeah.
I mean, but it makes sense with your size and your size that, you kind of manage your grants to specifically what you need.
Right.
And then we have several small towns that really are not there yet. So that helps get into the collaborative actually building their resource, their capacity first.
Yeah.
It's like putting on your face mask. You guys have got to have the resource to be able to manage it in order to help us. I mean,
So
We
what's,
can just check
what's- so
those
what's the
boxes,
best
we're not
way-
getting done. We're
what's the,
good.
so wrap this up.
So
What's-
I'm
okay.
gonna touch base with Rebecca and see,
Yeah.
as well as I'm gonna touch base with Great Barrington and then, Sheffield and Mount Washington. New Marlboro, sorry, and just see what's needed. And,
And I need
and
to
I'll
get,
just kind of move, I'll.
We'll just figure it out.
Yeah,
and I need to get back to the group that I was working with for the standardization and see where they are. Because they were supposed to be setting up all of these inspections
Right.
for me, and they're not. So I would love to tag along with yours.
Yeah.
But there's no need for two to be doing it. So if you're doing it for Jordan and they're setting up, it's easy for me to tag along with that.
So we'll touch base.
Yeah.
All right, back to you, Mike. If we can see and hopefully hear you now.
Okay, and I apologize for that. I always hate doing it from the car, but okay, so just to go back through the mechanics of this thing, it is designed so that I heard somebody mention their Board of Selectmen, and it's designed to make you Board of Selectmen proof. And also social media proof. That's what my biggest concern is, that particularly after the masking and the vaccination and the anti-maskers and anti-vaxxers, they're all looking for things that boards of health are doing that they can be critical of. And you're going to really be laying your bones bare on this particular capacity assessment. So it's designed so that as long as you don't create a record, there is no record. Keep that in mind, because you're going to be inputting to a survey monkey that's received by a private corporation. And what you've sent out, you have no record of, so you don't have to create it under the public records law. You don't have to create something that doesn't exist. It's received by a private corporation. That private corporation will crunch all of the numbers independent of anybody on the state level, working with MHOA, with Don Sibber, and with her crew. They will come up with a composite report for your shared service group. So there's nothing that can be traced to Great Barrington. If you have somebody who's out to embarrass Great Barrington, there's no usable statistics for them to use against you. Your Board of Selectmen will not see your town's responses. They will see the aggregate response for the entire sharing group. So the money that comes from the state and all of the resources, education, the trainings, and everything else that they're going to be dumping in from the ARPA funding will come to your public health excellence shared group, not to any one of the towns. So there's no singling you out. And there's nobody to answer to. There's no method for them to hold you accountable for anything. We've really worked that out. Because this is one of those times, it's kind of like when you go see the doctor and you might have something that you're not comfortable talking about. You don't have to be uncomfortable, because there's no way that this is coming back on anybody, and it's designed so that it doesn't. Then the next phase is that they're going to be reaching out to everybody that works in a public health function. So if you have an inspectional services division in your town that has inspectors that do some of your health inspection work, those inspectors, even though they're not within the health department and they're in inspectional services, or even in sanitation, DPW, some of the towns have DPW workers that do something that may impact public health, traditional public health functions. Those people will also receive questionnaires, because that's going to be a full capacity assessment of everything that has to do with public health in all of your towns. Then once it's done, we're just I'll give you an inside track on something. We're looking at probably publishing sometime after December 1st, or right around December 1st. It will be after the election, because we don't want anybody using anything for any political purposes. So it'll be after the election. It will be at such time as if the Secretary of HHS
in the current administration wants to use this as a tool for anything, it will be useless because everybody in her office will be packing their boxes up on their desks at the time that this comes out, and the new team will be coming in. And so we're really anticipating every conceivable loophole that could be used against public health to embarrass it at a time when we're working very hard to, as you know, with the safe legislation, we're working very hard on getting that back on track, and it will get back on track. There's the money for this program is going to be there. The safe legislation that we're working on is really the roadmap for how it gets spent, and it was kind of foolhardy not to have signed it after we got through both the House and the Senate unanimously.
I know, that's ridiculous.
Yeah, well, we'll get it back. We are 99.9% confident that we're going to get this back. We do know that there's going to be at least 1 or 2 more general sessions of the legislature because they're not done with some crucial stuff. You know, there's no spending bill, for instance. That's kind of something that they've got to get back together again. There's a lot of economic development legislation that they didn't get done with. So they're going back into general session. It's just a matter of when, and when they do, we are poised to pounce. By background, the governor sent it back with some questions that were driven by they were driven by the Mass Municipal Association. But they weren't driven by MMA, because if you talk to their board members, they were all in favor of it. They were driven by Jeff Beckwith, their executive director, and he kind of went off the reservation. He's got some very angry board members right now who are very offended by the fact that he took some steps that he took, which were against the dictates of some of the board members. It was never brought up formally to the board. So we're working actually hand in hand with them to take all of there's only one issue, and it's on line 33. They want it to say contingent upon funding. And it already says that in like 4 other places in the bill. It's pretty complicated. If anybody wants, I'd be happy to spend time, but I don't want to waste your time right now. But we will get that through. And even if we don't, we still have the money coming for the next, well, it's a 9-year program, and it's always going to be there because DPH will put it in if no one else does, because they're so invested at this point. But so we're solid that way. We are solid as far as protecting you from any kind of scorn or ridicule for any of your shortcomings that will be perceived as shortcomings, but they're not. It's an issue of your towns are not giving you the resources to resource your health departments properly, and the state understands that, and the state will step in and start distributing money to fill all the holes. So
Great, thank you, Mike. That's very helpful.
just to get everybody on the same level. That's
Right.
what we're trying to do.
We're waiting for it. Hasn't come yet.
Okay, and then the other thing is when you have, if you have a problem doing this, I know Jim has volunteered to help you out. Your representative, I think it's Jeremy that's working with you guys in that area, Jim.
Well, he's all done. We're meeting with Jay and I are meeting him one more time, but we have someone new coming in.
Okay, well, whoever that is going to be working with you guys to help out, but so will Cheryl and I if we have to.
Yeah.
You know, I'm planning on driving to a lot of strange places over the next several weeks to help people.
Yeah, we'll
out.
be in good shape. I think we're here to support each other. We'll get it done.
Okay, and anything I can do, you all have my contact information. You-
Yeah.
And Mike,
On the
this is
house
Jane.
shirts.
I am gonna be reaching out to you in particular with Sandusfield. Because they,
I meant to call you yesterday, Jane, but I had it
That's
in the
fine.
same day, so.
nope, we're all right there, but I will be reaching out for that, but I won't bore everybody with
We can
that.
talk later today. I'm free today for most of the rest of the day, so.
Okay,
Cool.
perfect.
Thank you.
Thank you, Mike.
Thank you,
Right.
Mike.
Okay,
Thank you all.
the next topic on that list is community support.
Oh, well, we want to,
Oh, you want the supplanting of funds?
Oh,
Yeah.
sorry, I thought that was covered in the other one. Go ahead. Planning of funding clarification guidelines.
so DPH has come out with some clarification on supplantable of municipal funds. I mean, we've talked about it from the very beginning about that we can't supplant existing funds with this program, with this public health excellence grant. And so they gave some different examples of that clarified kind of, I think, at least for me, the parameters of what that means. So like previously, we had kind of talked about, most of the towns just actually did sign up and with the collaborative to go ahead and give us whatever they were spending for public health nursing previous. There were, and there has been some discussion, and I feel like this just really clarifies it, that like,
That we were right.
well, but I think that where it did clarify a little bit is, I think at the beginning, we thought as long as it was being spent on public health, that was the important thing, and this really clarifies it, that it really has to stick with the program. What I'm gonna be talking to Mike about, for instance, is the example too, where, you know, if they've been spending $4,000 per year on a contractor, and then the collaborative starts providing those services, then that money would need to go, you know, that extra money.
In the budget, the money that's in the budget.
Yeah.
Not money that's already been spent, but money that's in the budget under that line.
That's what I
Right.
believe.
Right. Right.
Well, and it came up through our collaborative too, because Sam Wong actually met with Jane and I, and basically, I won't say he put us on the spot, but he basically, so I think with some of the transitions with towns, picking up Sandusfield and Darringham, he called us to the carpet a little bit, asking about that. So we're working with all the towns on that. But like, I think initially when we were talking about this, was like, all right, we'll just buy flu, which we are. We're using all the money that we're getting from all the towns now is going towards vaccine and supplies and
The freezer
TB
funds.
cases and da. But you know, it's gonna be one of those things, you know, and the first purchase of vaccine was $60,000, 20 of which we were fortunate that they allowed us a one-time use of the grant. But we're going to be on the hook every year for vaccines, for example, right? And I know, we know, for example, that down the road we'll get reimbursements. But like what we should be thinking about, and then let's not dive into it today, but like we should use those annual allocations to buy our vaccines and then use the administration for programming support, because it's a sustainable way to keep the vaccine program running, rather than waiting 8 months to see how much we get, because then we got to pre-purchase again. We don't, it may be 8 or 9 months, for example, to get vaccine administration. What happens if we have to buy more vaccines this year? So we took a stab at buying vaccines. We may need more. So it's just, you know, so he was asking us specifically, you know, like, well, I'm hearing that you're supplanting funds. I'm like, no, we're not. We're sorting this through. You know, the dust is settling. We're figuring all this out and whatnot. But then they came out with these slides and whatnot. So, and I can understand where they're coming from. You know, the PHE is meant to expand, not to replace, right?
Right, but I have a question about how this goes back to town budgets. All right.
Well, it's whatever you currently budget now. And it just, so right now, all the towns, well, Sheffield was a one-time contract, and we're still working with Great Barrington, but all the other towns, we signed a one-time contract. We just invoice every year and we put into the protective account. It doesn't go to the general fund. It goes into our account for the collaborative, for our resources.
Right, but well, for us, for our town, should we for the next fiscal year, because we're starting on this in December,
Yeah,
all right?
level fund it, just level
Then-
fund it.
Well, they're not funded at all.
Well,
Mount
there's only
Washington.
one
So
town
that-
there's only one town not funded at all.
So that's what I'm
you
saying
know.
is that should we then be putting this into our finance committee and saying, look, you know, this is, I mean, is that something we should be working towards? Of
Well, if
course.
you've never funded it, I don't see how you could justify funding it now, especially.
Well, you
if you're
can-
gonna
No,
transfer
but
it.
we-
Well, you
should
can.
start.
Well,
I
we
mean,
can help you come up with those talking points, but most towns fund something. It's not a lot,
Right.
but like, you know, but each town is putting in their share for vaccine costs, like Otis is, Monterey, Tri-Town, this town. You know, there's only one town technically that
Right,
doesn't
well,
have
I
any
know.
funding.
Well, that's what I want to do. My argument with our town is that they need to start stepping up to the plate.
Well, we can help you. We can help you as
Okay.
that time comes.
All right.
Yeah,
Yeah.
we'll help you figure it out.
It's
Don't,
not
no,
that the
no
board of health
worries.
doesn't do it, it's that there's not a political will up there to do that.
Well, this might be a weird year for Mount Washington Board of Health to be asking for extra funds.
Okay, maybe that gets us to the next topic.
Yeah.
How are things?
Terrible. It's getting worse. But if anybody did write something, I didn't get a copy of it, but if you did, thank you very much. Where it is now is that I did put together a packet that went out to the vast number of people in the town, which I will now send to all of you, just so that you know what's going on. It really just points up the fact that maybe what we can talk about, not on a specific situation, but how do boards handle situations that are just totally off the reservation? And one of the things that I'm curious about on, our capacity is our capacity for any kind of legal
Legal.
expertise,
Right.
which we have a town that just downvoted in their annual meeting to cut what little budget they had for legal to $3,000 a year. They now have, and we're now being sued over something else. The Board of Health is, although it's a very weird situation. So the select board last night had to say, well, you have to go to an attorney because the town is being, the Board of Health is being sued, but there is literally no money. So is there a place in our capacity for Board of Health legal information as opposed to general counsel?
Right.
I don't know.
And does that then?
I do. We have the contract on that with the state. We do legal technical assistance, legal TA. We will not represent you in court, but we will certainly give you all of the legal help that you need to understand what's going on. And we can't get in a position where we're representing clients because we're not a law firm. But Cheryl very frequently gets involved in issues that involve legal claims against boards of health for various things. What's the basic claim?
Oh, you don't even have
So
time.
Ellie, why don't you
Okay,
connect with
okay.
But
Mike?
I'll talk to you, okay?
Yeah.
Why don't you call me later?
As helpful as she could, but yeah,
Yeah.
but what I'm talking about is how this collaborative might actually find people who can help us. How do you respond,
Well, it's a
how do you
training.
respond to a hostile meeting?
Right, I think it's a training issue.
Well, we do those trainings. We do. In fact, I do that part of the training on how to respond not only to a hostile meeting from the public, but with the advent of the anti-maskers and anti-vaxxers getting onto boards of health, we've had some unbelievable situations, including Cheryl and I having to be escorted out of a meeting that adjourned abruptly when one of the Board of Health members wanted to meet us in the parking lot to continue the discussion about individual rights over masking and vaccination.
Right.
Right.
All right, so I think one of the things that we're
That
saying.
was one of the things
Right.
that I wanted to put out to the board to think about,
Right.
was that I think this is a very worthwhile subject for us to do.
To have a complete session.
To have
Yeah.
a session on.
Yeah.
That, so
Yeah.
that was where I was coming with
Right.
that.
There are other thoughts on that topic. We certainly will revisit it, but I think in the meantime, if we can solicit some individual or company or whatever to do that kind of training and see if it
Yeah.
fits in somewhere.
I mean, I think there's a training thing too, and I know traditionally, and Mike can probably attest to this, because I put my tobacco hat on for years. A lot of boards of health, especially in smaller rural towns, never really had access to their legal counsel.
No.
Some towns are fortunate, but some towns are. Sometimes you gotta get permission, and that's a big problem, Mike.
It's not small towns though, Jim. It's even, we're seeing it right here in Framingham where
Yeah,
the Board of Health has been instructed you cannot talk to counsel, even though we have an in-house city solicitor, that they're not even allowed to talk to the city solicitor without permission of the mayor.
yeah.
I mean,
It's a way of
ridiculous.
politicizing boards of health by limiting their access. It's very interesting.
And very.
What town was that I'm sorry, I didn't see, what town was that that's having that legal problem right now?
Washington.
Mount Washington.
Okay, okay.
Right.
It is on the map.
No, I know.
And Sam does have emails from us.
Okay.
Okay,
Okay,
thank you very much. But I think if we can look for a training session and then an opportunity to engage in it.
And also so that members of the member towns can speak freely to the collaborative and say, is there something that you can support us with as professionals?
Right.
You know, that was one of the things that I was hoping for and that some people did, or at least one person did, was to have something on the file that says, this is a professional way of handling this. We've looked this over and the board agrees that this is reasonable, you know?
Yeah.
Now, I know that there's pitfalls in that. And nobody's asking anybody to do anything that's going beyond what they feel comfortable doing. But I think we all recognize the fact that we, you know, even with all of the different towns and the different ways things get interpreted and done, we do have a baseline of what's a acceptable procedure. And I think that for a lot of us, you know, it would be helpful that you don't feel like you're the only person who
On the
planet there, you know,
Yeah.
that, you know, did I just wake up and make this all up, or no, I did hear this somewhere.
And a
That-
lot of those procedures exist, like disciplinary procedures.
Oh, yeah.
That way it takes the agent, it takes the onus off the,
Yes.
And we see it with septic, we see it with food,
Right.
we see it with housing,
Right.
like where you have like a set procedure so that you're like, I'm just following the approved
Right.
procedure.
Yeah.
And those, I
Right,
really.
but that's one of the problems with that, is that set procedures are different in every town because of the Commonwealth thing.
Mhm.
So
Mhm.
there are subtle differences in that, and,
Right,
but
but
anyway, that's
yeah.
hard for a discussion.
okay, just put on your calendars that on the 22nd of September, which is a Thursday night, or on the 13th of October, and it's looking more like it'll be the October date, MAHB is going to be doing a Zoom certificate program where we're going to be covering board governance and how to handle problems at board meetings. We're going to be talking about open meeting law and public records. We have people coming from the AG's office and Secretary of State's office
Cool.
as part of that program. It's exactly the same program that we did out in at the Delaney House, but we're going to be doing it statewide on a Zoom for those who couldn't get there.
Excellent, thank you.
Mike, did that go out yet at all? Is it you still working on
No.
that?
No, Cheryl and I are working on the program right
Okay,
now,
cool.
and I just realized that it's 2 weeks away if we're going to do it in September, so we're probably going to do October.
Okay, cool. We'll send it out to everybody. Thanks for your help.
I'll let you know as soon as we know the date.
So community partner updates.
I just wanted to throw out there that the extended drought followed by the 6 inches of rain that we got has been really hard on wells. And so I know that offer to something that's being voted on Monday, an advisory just suggesting to people that they get their wells tested. And I wanted to know if anyone of the other towns were interested in like a collaborative approach, so that like I know, for instance, that Housatonic Water sometimes will come to, I think, Egremont, Great Barrington, and West Stockbridge in the past. But do we want to do something like that and have like a couple weeks where people could drop off their water samples? Or do we want to just put out information on the most recent form on how to get your water sampled? Because if you have a problem with your well, it's going to show up this week.
Right, well, I think, my immediate reaction is, if we can put out an information, a collaborative suggestion
Yeah.
to everybody again on the website and say, look, here are the conditions that could create a really major problem. We
Check. Check.
recommend that you get your water tested.
And here's how to
Do you
it.
have
Here's
something
how to
typed
do
up,
it.
Jane?
Mhm.
We'll send it.
All right.
I'd be more than happy to do that. We actually test wells at Tri-Town too, so.
Okay.
And I think, when you tell people they should, we don't want to recommend anybody, but like maybe put some resources on where you can you call to get your well tested, because it's like,
Mm-hmm.
you get the information and then people don't know where they get their well
Right,
tested.
The hard part about the well testing is it's easiest if the towns have the water bottles.
Yep,
But then by having water bottles from Ecolab, for instance, or Microbac, you're automatically
Yeah.
recommending them, but they're the least expensive ones.
yep,
So there's
There isn't.
Housatonic water will come and they just give it to Microbac.
yeah, so Housatonic Basin is. Yep, they do
Yeah.
probably well
Oh,
testing, yeah. We do probably.
Do you all
well
know that
testing.
there's a seminar this afternoon on, put on by the Western Mass Public Health Association on
Yeah.
water wells?
Yes,
Yes.
there is.
Oh,
Yes,
okay, just want to make sure you knew that.
Yeah, so Housatonic Valley Basin, not Housatonic Valley Water, which.
I was wondering about that.
No, so Berkshire Engineering also tests it, but I think that they actually just bring it next door.
Yes.
They do, yeah.
But they're nice because they'll come out, so like, they used to have a route where the health departments would put water samples on the refrigerator on a Tuesday, and they would come and pick it up. That's the service that they provide, which is really nice, but it's a lot of work on our end to coordinate it, and then what happens if.
I think it should be in the hands of the individual and give them all the information they
Yeah.
need and encourage that it be done, but.
Yeah,
Okay,
yeah.
I'll send out the wording,
I only know of one lab. Are you saying that there are other labs?
It's not a lot.
Berkshire Engineering used to do their own water testing.
Okay, but now you think they just bring it over?
They
to
just bring it
Microbac?
next, yeah, they bring it, because it's in the same building. Mhm.
Okay.
And then it sounds like Tri-Town also does
We do
one
it, yeah.
they do the total or
We do
equal,
total. yeah.
total solar farm.
But
Yeah.
people from Great Barrington, I can't bring it.
They can do it, well, I mean, there's a fee to it, but we do Terringham's water, and we do our own beaches, we do our own ice, we do our own pools, and we do
Yeah, but do you
wells.
really want to put that out there for all of these other guys to?
Yeah, I
start
mean, it's a
putting up
comp,
their
I mean,
lab?
I'm not promoting a tri-town to do more work, but we do it for our town.
So Microbac is sending me their updated sheet and some bottles. So maybe there is an issue with really like recommending one place or the other, since there really is only one.
Yeah,
and so-
Microbac is the only place
And if you call them, they'll send you a box full of bottles, and then you just set them out at town hall for people to pick up.
but then they have to bring it to.
Yeah,
But then
they're
they
on
would
their
bring
own, yeah.
Then they're on.
Yeah.
Right.
Very helpful, thank you. And as Mike said, there is that session tonight on Zoom on wells and water, which I'm glad to have the opportunity to participate in. Citizen speak time? Any citizens out there?
I see Jordan's on the call. Thanks for attending, Jordan. Hopefully I'll meet you someday.
Okay, upcoming events, we have the Smash the Stigma. I hope that many of us can make that. And the conference, and thank you, Jane, for arranging registration and so forth.
Yeah, and registration, the bill will be paid sometime this week or next week. It's at the top. We did all one
Yeah,
shot.
yeah,
Yeah.
God, that was a journey.
And so. Once the conference is over, for those paying for hotel. Pay for it, give me the receipt, and then we'll process it. And then the FDA will reimburse not only, because we don't have a line item, by the way, that pays for the MHOA through PHE anymore, because it's so staff heavy, but. That's where the FDA grant comes in, right? We have the capital to pay for it, then we get reimbursed, and it's like.
Right.
Perfect.
Yeah.
Hope to see you there.
Yeah.
Be
me
fun.
too. Me too.
Okay, and don't forget the Great French Bakery in downtown across from the library. Okay, then the next meeting date is the 14th of October. Same hybrid meeting, I guess.
Yeah.
So-
I have a question about meetings. Quite. Is it required, and Mike, that this is for you too, is it required that public boards have to do Zoom meetings?
No.
It
Mike
is
and-
not, right, Mike?
No,
So,
No,
I
you-
mean, I can help. I don't
Because
need
I
the
know,
attorney to
because
answer
what
that.
happened is that they passed it first and then
Yeah, yeah.
it got changed, right?
So.
Yep.
Okay.
Mike, correct me if I'm wrong. So there's a couple variations. So you do full in-person meeting. You're not required to do a hybrid. It's a fully in person. You can, I think you can still do full remote because that's been extended. You can
Right,
do full remote,
okay, so.
but
what's
then
the
there's a
cita-
hybrid option.
Right, but where's the citation on this?
There isn't. So like for the only requirement right now is it's an anomaly, but the town of Stockbridge passed a bylaw requiring all boards to be a hybrid option. So when I run a Stockbridge meeting, I have to do it in person with hybrid, and you have to have a quorum of the majority of the board has to be in person.
Okay.
So the third
because
person can remote in, but that's a Stockbridge
Mount
centric bylaw.
Washington, as of last night, is being sued again. The second suit this week, because the select board held a non-hybrid meeting, but it was posted. That was posted, totally everything. And
There's no
this same
merit.
group came in and trashed the meeting to the point where one of the selectmen again walked out without them being able to adjourn it with all of the selectmen there. This is making the Wild West look like
The Wild West. yeah.
kindergarten.
I'm going to check on that. I do have a call this afternoon with the AG's office. With the
Because
office.
our board, our select board now has to answer officially to this ethics violation filing
Okay,
that they did not have. That they did not have a,
There's no merit to that, but whatever.
I'll shoot you all an email after I speak to them today.
thank you, Mike.
All right.
All right.
Motion to adjourn? I move it.
No, she did it.
Thank you all.
We'll see you all. Bye-bye.
Thanks.
Thank you, Mike.